stress and uncertainty that accompany a pandemic, experts worry that suicide rates could increase. News 4's Caroline Hecker joins us to explain what the data shows and what you can do at home to keep your kids safe. Caroline?
Well, good morning. Even before the pandemic, a parenting and mental health expert that I spoke with said both anxiety and depression among kids were already on the rise. Now you couple that now with the increase of unpredictability as well as kids really their need for routine, and that's where that concern comes from over the potential for the rise in the amount of self-harm taking place in that 10 to 24 population. Now the company, it's called Bark. What it does is nationwide it partners with both school districts and parents to kind of keep a lookout and monitor social media platforms, text messages, emails, to keep an eye out again for any kind of potential for harmful behavior. And it tells me it saw a 123% increase in the number of emergency calls that came from both parents and school officials in August of this year as compared to July. It says it's the isolation and the uncertainty that come along with both virtual learning and COVID-19 that can lead to that increase in anxiety and depression, or even worse, suicidal ideations among children. The best thing you can do at home, they say, is have that open line of communication with your kids and let them know that however they're feeling, it's okay.
I think the biggest thing is the uncertainty. No one can tell us with any certainty when things will be okay again. So it's the fact that we don't know when everything is going to be okay. Children crave routine and predictability, and this is everything but that. We cannot give them any answers, and so that's really hard for a child to absorb.
The best thing Jordan says you can do as a parent is listen to your gut. And remember, she says, there's a difference between your child having maybe an off day versus an off week or even an off month. And she says some things you can keep an eye out for: changes in appetites, if you see their grades starting to drop, or any kind of agitation or anxiousness when it relates to having their phones nearby. We're live in downtown St. Louis this morning. Caroline Hecker, News 4.